Hello guys, welcome back to my YouTube channel once again. So today we are going to do a condition known as meningitis, and it's a condition that's affecting the central nervous system, which comprises of the brain and the spinal cord. So guys, before we continue, don't forget to like, share and subscribe. Hit the subscribe button so that whenever I post any video, you'll always be the first person to get the video. So, what is meningitis? Meningitis refers to the inflammation of the meninges, that's the protective membranes of the brain and the spinal cord. They are known as the meninges. So when they get inflamed, it results to a condition known as meningitis. There are different types of meningitis, and the different types of meningitis are categorized according to the causative agent. We have bacterial meningitis, which is caused by bacteria such as Streptococcus pneumoniae. We have fungal meningitis, which is caused by fungi such as Cryptococcus neoformans. We have parasitic meningitis, which is caused by parasites such as Teniacelium. Teniacelium, it's a tapeworm, and specifically a pork tapeworm. As we all know, pork refers to pig meat. So whenever you ingest meat that it is infested with the Teniacelium, it migrates to the brain and results to the meningitis. We have viral meningitis, which is caused by viruses such as mumps virus or influenza virus. We have drug-induced aseptic meningitis, which is caused by medications such as antibiotics such as penicillin and NSAIDs, that's non-steroidal inflammatory drugs such as brufen. Next, we're going to do the pathophysiology of meningitis. So when the causative agent, that's the bacteria or the fungi or the parasite, invades the central nervous system, and as we have said earlier, the central nervous system comprises of the brain and the spinal cord, it initiates an inflammatory response. So when the inflammatory response is initiated, the immune cells and pro-inflammatory mediators migrate to the brain, and the immune cells comprises of the neutrophils, microglia and macrophages, while the pro-inflammatory mediators comprise of the chemokines and cytokines. So when they are released, they migrate to the brain meninges. So the inflammation process itself interferes with the blood-brain barrier, making it permeable. And so also leakage of fluids occur into the brain parenchyma, resulting in cerebral edema. So the cerebral edema compresses the brain structures and impairs cerebral blood flow and results in elevated intracranial pressure. The elevated intracranial pressure is the one that usually causes the symptoms that the patients with meningitis presents with. That is headache, altered mental status, papilledema, cerebral ischemia, and neuronal injury. So we have the different ways in which the causative agent reaches the brain. We have the hematogenous route, which is through blood spread, or through the bloodstream. So the causative agents such as the bacteria invades the nasopharynx, then enters the bloodstream, then crosses the blood-brain barrier and reaches the meninges. And the hematogenous route, it's the most commonest route for bacterial meningitis. Then we have the second way, which is direct spread, whereby the infection starts from adjacent structures such as the sinuses or middle ear. So when the bacteria invades the sinuses or the middle ear, they can migrate to the meninges through the bone or the tissues. Then we have the nosocomial way. Actually, this is hospital-acquired infection, whereby you acquire the infection while you are admitted in the hospital. So what are the signs and symptoms of meningitis? We have fever, which is often high grade. We have headache, which is severe and persistent, and it may continue worsening. We have altered mental status, whereby the patient presents with confusion, disorientation, irritability, or change in consciousness ranging from lethargy to coma. We have photophobia, whereby the patient is sensitive to bright light. We have seizures. We have petechiae or purpura. Petechiae are small red or purple spots, and purpura are large areas of purple discoloration. We have the rash, and in the infant may present with bulging fontanelles, irritability, and poor feeding. Next, you're going to do the etiology or the causes of meningitis. What actually causes meningitis? We have the bacteria, as we said earlier, such as Streptococcus pneumoniae, Neisseria meningitidis, Haemophilus influenzae type B. We have the fungi such as Cryptococcus neoformans and Candida species. We have the viruses such as the herpes virus, influenza virus, and mumps virus. We have the parasites such as the Naegleria floweri and Angiospermolus cantonensis. And we also have other non-infectious agents such as autoimmune conditions. That's whereby the body's immune system fights against the body tissues. We have chemical irritants and drug reactions. Then we have how do we diagnose meningitis? The following tests are performed to diagnose meningitis. We have the lumbar puncture, whereby a sample of cerebrospinal fluid is collected to check for signs of infection. Blood samples may be collected to check whereby culture sensitivity can be done, to check for the type of bacteria, and also complete blood count can be done to check for signs of infection. We have imaging procedures such as CT scan, that is computed tomography, or magnetic resonance imaging. These ones are done mainly to check for inflammation. We can collect nasal or throat swabs to check for infections. Remember, we said that sometimes the infection may start from the sinuses or the nasopharynx before it finally migrates to the meninges. So samples can also be collected from the nose. So what is the nursing management of meningitis? So first, we assess the patient's medical history, current symptoms. So here, we first collect the chief complaints that the patient is presenting with. The patient may present with headache, stiff neck, nausea, vomiting, photophobia, altered mental status. So you have to collect the chief complaints first from the patient. After collecting the chief complaints, you can proceed to collect the patient's medical history, family history, socioeconomic history, nutritional history. This type of history enables you to also come up with the appropriate nursing care plan for taking care of the patient. So, after collecting all those history, you can also perform a physical examination to collect data, that's observable data. You can collect the vital signs such as the temperature, pulse rate, blood pressure, and the respiratory rate of the patient. Then also don't forget that especially in the physical examination, don't forget that this is a condition that's affecting the central nervous system, which mainly comprises of the brain and the spinal cord. So you have to assess the neurological status. You have to perform a neurological assessment, including GCS scoring, which is used to check for the level of consciousness or monitor the level of consciousness in a patient. So mostly when you're performing the physical examination, you can focus on the head, whereby you find in an infant, you may be able to notice the bulging fontanelle in an infant. Then perform the diagnostic procedures, that's the lumbar puncture, collecting blood samples, the imaging procedures to diagnose the patient. Then also ensure adequate hydration for the patient. For those patients who can take fluids orally, you can encourage them to take a lot of fluids. And for those who are unable to take fluids orally, you can administer them intravenously. That's done to ensure and to maintain the electrolyte balance in the body. Then you can monitor and support the nutritional intake of the patient. And in monitoring the nutritional intake of a patient, ensure that the patient consume a balanced diet and the food should be adequate. Remember, this patient has nausea and vomiting, so you should maintain and support the nutritional intake of this patient. You can manage the symptoms by administering antipyretics such as brufen for the fever. You can also manage pain by administering analgesics. So in administering analgesics, you can actually check the level of pain. For those patients whose pain is much lower, you can administer paracetamol. There are also some other medications which can be administered for pain, such as Rolac. There is morphine, but actually these medications. Then you also need to check and monitor the patient's respiratory status and administer supplemental oxygen if necessary. In case that's in case of a respiratory distress whereby the patient is struggling to breathe. We have implement seizure precautions whereby you lift or padding the bed rails. You ensure a safe environment, and you can also administer anti-epileptic medications such as phenobarbital, phenytoin. Then you can also isolate the patient to prevent transmission to other patients. Then you can place the patient in a proper head position to provide comfort and encourage the drainage of cerebrospinal fluid. You can provide emotional support and address any anxieties or concerns that the patient or relatives may have. Educate the patient and relatives about meningitis, the treatment plan, and any complications and the recovery process. You keep updating them in order to relieve their anxieties and also to help them understand more about the condition. Then you can coordinate follow-up care and appointment for the patient. That's in case of a discharge. So that was the nursing management of a patient with meningitis. Then you have the medical management of a patient with meningitis, whereby we have administering antibiotics, the third generation cephalosporin. That's for bacterial meningitis actually. We have fungal meningitis. You can administer amphotericin B. You can administer corticosteroids such as dexamethasone as adjunctive therapy for bacterial meningitis. You can also administer anticonvulsant medication such as the phenytoin, as we said earlier in the nursing management, though it's supposed to be in the medical management for seizure control. We have providing supportive measures including fluid and electrolyte management, fever control with antibiotic medications, the management of pain and discomfort. Then you have also monitor and manage complications that may occur as a result of meningitis. So finally, we are going to cover the complications that can occur as a result of meningitis, especially if it is not treated. We have increased intracranial pressure, which occurs as a result of inflammation of the meninges. So the increased intracranial pressure can compress brain structures, impair cerebral blood flow, and cause ischemia, by the way, which can result to symptoms such as headache, nausea, vomiting, papilla edema. The second complication, we have cerebral edema, which occurs due to the inflammatory process and increased intracranial pressure. We have hydrocephalus, whereby meningitis causes the obstruction of cerebrospinal fluid within the ventricular within the ventricular system, causing so we have said hydrocephalus, whereby the meningitis can obstruct the flow of cerebrospinal fluid within the ventricular system, leading to the accumulation of fluid in the brain, causing the condition known as hydrocephalus. We have seizures due to inflammation and irritation of the brain tissues. We have cranial nerve dysfunction. We have sensorineural hearing loss, whereby the inner ear structures are affected. And we have lastly septic shock and multi-organ dysfunction. That's in severe cases of bacterial meningitis. And finally, we can talk about death that can occur in a poorly treated meningitis or meningitis that has not been treated at all. So guys, that is the end of our session about meningitis. And one thing you should not forget is that meningitis, it's treated also according to the causative agent. As we said earlier, the bacterial meningitis has its own medication. The fungal meningitis has its own medication, such as the amphotericin B. The bacterial meningitis can be treated with antibiotics. So you should not use medication just because you know that you have a condition of meningitis. You should follow the doctor's prescription. So thank you guys for the session, and I hope you enjoyed my video. So I'm going to end it here, and bye guys. And also don't forget to like, share and subscribe. Thank you very much. Bye.